I'm going to talk about the top 3 questions I get as a rhinoplasty surgeon. One of them is kind of figuring out what the patient wants for their nose. I mean, there's different nose types, skin thicknesses, and what I can do with one person, a blue-eyed blonde with thin nasal skin, or Middle Eastern with thick nasal skin, is it a revision? A lot of that goes into the ultimate result. So somebody with thick skin may want a skinny little Barbie nose, ain't gonna happen. I always tell people noses are a little bit like breast augmentation. Some women want a very round breast and some people want a natural breast. Some want a very straight nose and some want a little more stylized nose or a little more scoopiness. So trying to figure out from the patient by showing them pictures, by them telling what they like or they don't like, is really helpful for me as the rhinoplasty surgeon artist to figure that out. The next is breathing. As I've become much more experienced with rhinoplasties, look, I've been doing this for 30 years, and rhinoplasty has been a big part of my practice. I'm really passionate about it. Every year I do, 200 rhinoplasties. And so consequently, breathing is a really important aspect of the exam, of the evaluation for rhinoplasty. And that is a part that people don't really talk about, but it's really important. And then the last thing is dealing with noses that aren't just your usual nose. Sometimes you have to think outside the box and you have to do certain things on a nose, especially with the revisions or multiple revisions, and you only get that through experience. You have to do hundreds, if not thousands, of rhinoplasties. So the last thing is you need a rhinoplasty surgeon that's committed, that's passionate, and experienced. And lastly, look at the galleries very carefully. Just because someone has a lot of rhinoplasty results doesn't mean that they're great surgeon artists. Look at their results critically on their galleries.